I am Professor Dr. Alaa Abdo, Head of Tropical Department, Faculty of Medicine, Alexandria University.
I am Dr. Mostafa Yakoot, Consultant Physician, Epidemiologist, and Clinical Research Consultant. We are going to present summary of our original research titled The Very Rapid and Ultra-Rapid Virologic Response as two new outcome measures to compare two treatment options in patients with chronic hepatitis C virus infection. The challenges of innovation.
The very fast-moving process of drug discovery in the area of directly acting antiviral therapy for treatment of chronic HCV is that the investigator would find faster method for clinical research to support fast decision, particularly in the comparative effectiveness research.
This should be also supported by the faster process of peer reviewing and publication.
Often new information becomes outdated by the time the research is completed and the manuscript is published.
It has been shown that the speed of virologic response to treatment is linked to the rate of sustained virologic response and hence to the rate of cure.
The faster the response to therapy, the higher is the probability for cure.
Early virologic response was defined as an undetectable serum HCV RNA or a 2-log or greater drop in HCV RNA at 12 weeks of therapy.
Rapid virological response is defined as an undetectable HCV RNA at week 4.
Our suggested new endpoints are the very rapid virologic response at week 2 and the ultra-rapid virologic response at week 1. In the new era of the direct-acting antiviral treatments for chronic HCV, with faster actions and shorter duration of therapy, we suggest two new interim endpoints for comparative effectiveness research.
The very rapid virological response is defined as the undetectable HCV RNA level at the end of week 2 after treatment.
While the ultra-rapid virologic response, which is new, we defined as an undetectable serum HCV RNA or a 4-log or greater fall in HCV RNA at the end of only 1 week of therapy. The study objectives.
To present a new model for fast-track comparative effectiveness research where both the speed and the size of the effect in two treatment on virus load within just 2 weeks of therapy are used to compare two generic sofosbuvir products, Gratisovir versus Grateziano, is a dual therapy protocol with ribavirin in patients with chronic HCV.
To compare the mean log reduction of virus load at week 1 and week 2 of treatment, as well as the proportion of patients achieving ultra-rapid virologic response by the end of week 1 and very rapid virologic response by the end of week 2 in both groups.
To evaluate the positive and negative predictive accuracy of both very rapid virological response and ultra-rapid virological response as on-treatment marker for comparative effectiveness and as a guide for rationalization of a shortened response guided course of therapy.
The study protocol.
Data collecting during the period of this interim report, 2 weeks from starting therapy, from the first 25 patients randomized to either one of two generic sofosbuvir products, Gratisovir or Grateziano, in a daily dose of 400 milligram tablet plus weight-based ribavirin dose were analyzed for both the degree and the speed of viral load reduction in the end of first and second week from starting treatment.
Virus load reduction at week 1. This figure illustrates that the baseline virus load showed a similar, markedly significant reduction in both groups, Gratisovir and Grateziano, by more than 4 logs at the end of week 1. Here at the baseline, you can see that the baseline virus load was about 6, decreased rapidly by the end of week 1 to below 2 logs. The repeated measures factorial ANOVA test showed that there is no significant difference between the 2 drugs by the end of week 1 of therapy. While here the virus load reduction at week 2 also showed that the baseline virus load showed a similar markedly significant reduction by the end of week 2 by more than 5 logs. That is to say, the baseline here was about 6 logs, decreased to even below 1 log at the end of the second week. The repeated measures factorial ANOVA test showed that there is no significant difference between the 2 drugs as regards the rapid decrease in the virus loads by week 2. This table shows that the ultra-rapid virologic response in both groups showed no significant difference between them. It was about 50% in both groups. While the very rapid virologic response, which is PCR negative or absence of detection of virus load at week 2, showed that both groups also have no statistical significance difference as regards the proportion of patients with very rapid virologic response. It is around 80% in both groups. In conclusion, we can conclude from this interim report that the 2 generic products are almost equally fast and efficacious in reducing hepatitis C virus load during the first 2 weeks of therapy.
The predictive accuracy of our 2 suggested marker of efficacy and the result of truncated 4-month response guided therapy versus the recommended 6-month course duration will be analyzed upon full completion of the study follow-up period. Thank you.
Thank you very much.